Okay, so I'm going to be doing a pediatric assessment on an 8-year-old female client. To begin, I would introduce myself and explain my role in caring for the child. I would confirm the name and the birthday, and I would explain the purpose of the assessment and provide privacy and remove any distractions. And I would ask open-ended questions to initiate the assessment and develop rapport. I would try to involve the child in the assessment as well and ask age-appropriate questions. And then I would just observe the child's general appearance and nonverbal behavior like eye contact, posture, and body movement. And then I would begin my data collection. So I would ask about the child's health history. I would get the height, the weight, and the baseline vital signs. And then I would ask about any present illness or injury, any pain, any previous or current treatments. I would get their allergies, their immunizations, and their activity, their exercise, nutrition, sleep patterns, family health history, and then I would begin the head-to-toe assessment. So to begin, I would start with the hair and the scalp. So any kind of like abnormal growth patterns, any bald spots, I would check inside the scalp to see if there's any crusts or lesions. And then I might do a quick neuro assessment, ask if she has any headaches, any dizziness, any learning or memory issues. And then I would go on to the eyes. So I would do a vision test. I would check the pupils, so the shape, and just the size of the pupils as well. I would do check the perla with perla, which is pupils equally reactive to light and accommodation, and then that would test for cranial nerve number 2, and then any drooping in the eyelids, which tests for cranial nerve number 3. And then I would check the eyelashes too, and then I would check the nose, so any nasal flaring, any difficulty breathing. I would get a pen light and then just check inside the nose to see the mucous membranes, to see if there's any swelling or discharge. And then I would inspect the mouth, so inspect the lips to see if the lips are moist, no dryness, no chappedness. Then put on a pair of gloves, check inside the mouth, and then just check the gums, like the teeth for cavities, the tongue, I would inspect the tongue, and then get my light and flash it into the back of the throat to make sure it's nice and pink, and the tonsils as well. And then I would check the lymph nodes. So how you can do that is you would start from behind the ears, go around under the jaw to the occipital area to the cervical chain of the neck. And then I would check the ears. So I would do just check the external structures, the pinna, to make sure that there's no malformations. I would inspect the external auditory canal for any discharge or smell. And then I would do a hearing evaluation as well. So I would whisper familiar words like Mickey Mouse into the ears and then have her repeat it after me. And then I would listen for heart and lung sounds. So for lung sounds, I would do the front and back. So I would do side by side, so like that. And then also in the back, and then on the sides as well. And then for heart sounds, I would listen to the aortic, the pulmonic, Erb's point, tricuspid, and apical points for heart sounds. And then I would check the bowel sounds as well. So I would auscultate the 4 quadrants to make sure bowel sounds are present, and then I would palpate for tenderness. And then I would ask for like bowel habits, like frequency, consistency, does she have any issues with going to the washroom? And then I would ask if she has any like nausea or vomiting. And then I would ask about the genitourinary system, so how frequently does she go to the washroom? Does she have any bedwetting issues? I would inspect the external genitalia, so the color, size, symmetry of the mons pubis, and urethra and vaginal opening. And I'll look for any abnormalities or swelling in that area as well. And then ask the child if she's aware of good hygiene and if she has any questions for me. And then I would inspect the musculoskeletal system, so like bones, joints, movements. So I would just do some coordination exercises with her. So have her like lift up her arms and her legs, have her push into my hands, and then also just flex, and then just see her reflexes. And then I would also just assess her posture and her spinal alignment. And then I will check her hands and feet, just check the nails to see if there's any abnormalities, any clubbing, any just a general appearance of her hands. And then also the feet to make sure that the toenails, there's no abnormalities. And then the bottom of the feet to make sure that she's not flat-footed. And then I would also check the cap refills and pulse points at this point. And then for skin, I would just check for color, warmth, and any abnormalities like lesions, like rashes or swelling or pain anywhere. And that's my assessment.